Slurry application. Slurry application is presently very popular when thoracoscopy is not available. It is performed after drainage of the pleural cavity for several days. When daily fluid production is less than 100 milliliters, a talc suspension in 50 milliliters of saline is injected directly into the drain. The drain is removed several days later when it has become non-productive. This technique is simple, but we have observed that injection through the drain leads to clumping of talc at the bottom of the chest cavity. Complications are much more common using the slurry method than the poudrage technique, especially in patients with spontaneous pneumothorax. The best indication for slurry application is recurring neoplastic pleurisy. Another disadvantage of slurry application is the need for longer drainage in comparison with poudrage. Now here's a little quiz for you. On which side was thoracoscopic talc poudrage performed in this patient who had bilateral pneumothorax and whose spirometric data were normal 1 year later? Answer: talc poudrage was performed on both sides. The last step in any thoracoscopic procedure is drain placement. Only short drainage is necessary after diagnostic thoracoscopy. We usually remove the drain as soon as the lung has re-expanded against the chest wall while the patient is still on the endoscopy table. Most patients are discharged either on the same day or the day after the procedure. We use a malleable drain introducer with a blunt tip. These features allow optimal placement in the chest cavity. Using the introducer, the drain is inserted into the chest cavity along the predetermined route. The tip of the drain should extend as far as possible toward the apex. The vacuum line is then connected at a low aspiration setting. Bubbling stops as soon as the lung has fully expanded against the chest wall. The drain should be attached to the skin. A single suture stitch should be placed so as to allow closure of the opening when the drain is removed. In placing the suture, care must be taken to avoid puncturing the drain. We do not use purse string stitches because tightening is painful and because residual scarring is less cosmetic. A dressing is applied at the end of the procedure. The drain can be removed 2 or 3 days after the procedure. With proper training and adequately designed equipment, pleural procedures allow safe, quick, and accurate diagnosis in most cases. Talc poudrage has proven to be a much simpler, safer, and more cost-effective method for pleurodesis than chemical techniques.